Good morning. This is Dr. Tariq. So, today I am going to discuss ventricular premature contractions, commonly known as PVCs. They can be from atria, which are known as premature atrial contractions, PACs, and from the ventricle, they are known as PVCs. As the electric impulse is coming from some ectopic focus, not from the SA node, so the conduction pathway is changed. Depolarization and repolarization is not through the normal pathway. That's why they give wide, bizarre, and notched QRS complexes. We know the horizontal give us time. Horizontal give us time on ECG paper, and vertical give us uh, amplitude of the electricity. So this is the normal time, but this has come early. This is small. Small means less time. So it is produced before the time. The same is here. It has come before time. So as the baby is born, like 6 months, 7 months, we call them premature babies. Similarly here, these complexes are produced before time. So they are called premature ventricle contractions. There are different type of configuration. They exist. Number one is there is ECG, which has a lot of uh, cardiac cycles, P and QRST all repeatedly. But there is only one ectopic VC, only one PVC. That is PVC is known as isolated PVC. The other configuration is there are two together, like here, there are two together. This is known as PVC couplet or PVC pair. Then they can be three together or more than three together. They are all known as salvo. Three or more than three PVCs together are known as salvo or more or three or more than three. If they are two together, they are known as pair. If they are only one, which is not showing here, if there is only one, that is known as isolated PVC. Now next configuration is there are chances one is normal and every second is PVC. Normal PVC, normal PVC. This type of PVCs are known as PVC bigemini. Bi mean two. As every second is PVC, so we call it PVC bigemini. Another configuration is this one. Two are normal and third is PVC. Two are normal and third is PVC. Same pattern will be repeated throughout the ECG. When every third is PVC, we call it PVC trigemini. Tri mean three. So two are normal, third is PVC. Two are normal, third is PVC. Same pattern throughout the ECG. So this is known as PVC trigemini. The other one configuration is there are three normal QRS complexes, 1, 2, and 3, and fourth is PVC. These are I've shown here two only, but because less space, otherwise same pattern, 3 normal and fourth abnormal, 3 for normal and fourth PVC. That pattern is known as PVC quadrigemini. So if they are one isolated PVC, if they are two together, this is known as couplet or PVC couplet or PVC pair. If every second is PVC, it is known as PVC bigemini. If every third is PVC, this is known as PVC trigemini. And if every fourth is PVC, 1, 2, 3 normal, fourth is PVC, this is known as PVC quadrigemini. Quadri means 4, like quarter. There is another configuration, unifocal and multifocal. Look the upper one, they look similar. So they are from the same focus. They are coming from the same place. But this lower one, they are different. So they are known as multifocal because they are coming from the different focus. They look same, they are unifocal. If they look different, they are multifocal. The characteristics of the ECG of this PVC is that P wave is usually absent. P wave is usually absent. QRS complex is PR interval does not exist. P wave is absent. PR interval does not exist. QRS complexes is premature, widened and notched. The QRS complex may be of greater amplitude than the sinus amplitude. Rate is determined by the underlying rate plus PVCs. Rhythm is irregular. These are the ECG characteristics of the PVC, ventricular PVC. Now, what are the causes, reason for this PVCs? Number one, if they want to, they can be ignored. They have no clinical importance. But if they are more than 6 per minute, then they need to be addressed. They can repeatedly come or they can be permanently present. So these can cause problems, so they must be addressed. The causes of the PVCs is if gastric overload, too much eating at the same time, or there is stress, or there is electrolyte imbalance. Electrolyte imbalance can also cause PVCs. Stress is very common. Excessive use of alcohol, nicotine or caffeine, all they can cause PVCs. Thank you very much. Please subscribe my channel and like my videos. Thank you.